Hello and welcome to this month's Got Health video presentation sponsored by the University of Rochester's Center for Community Health and Prevention. March is National Colorectal Cancer Awareness Month, where we take the time to recognize the importance of colorectal cancer screenings and prevention, as well as to honor those individuals who have experienced this disease or are currently coping with colorectal cancer. Colorectal cancer is among the top 3 most common cancers in New York State, and it is a leading cause of cancer death nationwide. The good news is that this cancer can also be prevented, and that colorectal cancer treatment works best when colorectal cancer is found early. And that brings us to our topic for today, which is how does colorectal cancer start, and what can you do to help prevent it? And my name is Hannah Farley. I am the Promotion, Education, and Targeted Outreach Manager for the Cancer Services Program of the Finger Lakes region at the Center for Community Health and Prevention. So someone you know has likely had colorectal cancer. And on the screen here, we see a couple familiar faces. On the left, we have Chadwick Boseman. He was a prominent actor. He played King T'Challa in Black Panther, and he was diagnosed in 2016 with stage 3 colorectal cancer. He didn't talk about his diagnosis or about what experiences he had leading up to diagnosis, such as his symptoms, or if he had a family history. His cancer did later progress, despite treatments, to stage 4, and he passed away at a young age, at age 43, in August of 2020 from colorectal cancer. His death from this disease at such a young age put a spotlight on the fact that colorectal cancer has been increasingly affecting younger adults over the past decade. The next one on your screen is actually a local guy, if you're in the Rochester area. That's Seth Voorhees. He's a news reporter on Spectrum One News, and he found out on December 29th of 2021 that he was one of the estimated 150,000 people each year in the United States to be diagnosed with some form of colorectal cancer. He had gone for a routine colonoscopy, which was actually his first at the age of 54, so well beyond the guidelines, what the guidelines say to start screening at age 45. And it was revealed that he had 5 polyps. One of those polyps did contain cancer cells. He had no symptoms for colorectal cancer, but if he hadn't gone for his colonoscopy then, that cancer may have never been caught early, and it may have had the chance to spread throughout the body. So it's a good thing that he went early. And in March of 2022, he was declared cancer-free. On the far, actually the next one, the woman with the basketball, that's Cynthia Marshall, or Cint Marshall as she goes by. She's a highly accomplished woman. She's an entrepreneur, the CEO of the Dallas Mavericks, and an author of the book called You've Been Chosen, Thriving Through the Unexpected. She was diagnosed also at stage 3 colon cancer back in 2010, just a day before her 51st birthday. She went through 12 rounds of chemotherapy, and she actually considers herself very lucky to have survived the disease when she was diagnosed at stage 3. And her last 5-year scan did show that there's no cancer detected, and she was declared cancer-free. And then finally on the far right, that is Sharon Osbourne. You probably recognize her from the old MTV series, The Osbournes, or, as Ozzy Osbourne's wife. Sharon was diagnosed with colon cancer in 2002 when she was 49. She had no family history for the disease, and she didn't share what her symptoms were leading up to her diagnosis. After her diagnosis, she did have surgery to remove about 1 foot of her large intestine and some of the surrounding lymph nodes. She also underwent chemotherapy to kill any of the remaining cancer cells that weren't removed during surgery. And she has since fully recovered from the treatment and has remained cancer-free. But her diagnosis does remind us that most people who do develop colorectal cancer do not have a family history of the disease. So how does colorectal cancer start? Well, colorectal cancer is cancer that begins in the colon or the rectum. That's the lower part of the digestive tract. And most cases of colorectal cancer begin as non-cancerous growths called polyps. And there we go. And a polyp, it's an extra piece of tissue that grows inside your body, and most polyps are not dangerous. However, some polyps may turn into cancer or may already be cancerous. And experts aren't sure exactly what causes colorectal polyps. However, research suggests that certain factors such as age and family history can increase your chances of developing colorectal polyps. And anyone can get polyps, but certain people are more likely than others. You have a greater chance of getting colorectal polyps if you're age 45 or older, or if you have a family history. So someone that in your family that's had colorectal polyps or colorectal cancer, or if you have a personal health history of polyps. And most colorectal cancer polyps do not cause any symptoms. If you have symptoms, that might include things like blood in your underwear or on the toilet paper after a bowel movement, blood in your stool, or constipation or diarrhea lasting more than a week. And polyps usually take many years to turn into to become cancerous. So what are some of the tools that we can use to help prevent colorectal cancer? And so I want to say, though, that researchers don't know, they're not sure quite yet exactly how to prevent polyps and colorectal cancer from developing. However, we know ways to really reduce our risk for this disease and for polyps forming. And one of the things that we can do is eat well. So by eating a more nutritious dietary intake, sticking to a healthy dietary pattern, you can reduce your risk for developing colorectal cancer. So those are things like eating less red meat, such as pork, beef, or lamb, and less processed meats such as deli meats, hot dogs, and bacon, and incorporating a greater amount and variety of fruits and vegetables and legumes and whole grains. We can also make some healthy lifestyle choices that can reduce our risk. So getting regular physical activity, maybe joining a walking group or taking online dance classes, that reduces our risk for colorectal cancer. Also, not smoking cigarettes can also reduce our risk, not just for colorectal cancer, but many other diseases. Drinking less alcohol and getting to and staying a healthy weight. All these factor into decreasing your risk for colorectal cancer. And then finally, screening tests. Getting tested for colorectal cancer actually reduces your risk of developing the disease. Since early colorectal cancer usually has no symptoms, it's really important to get screened for this disease. And the screening just means checking for the disease before you're experiencing any symptoms. And on your screen here, I listed just a couple really popular, I think maybe more of the most well-known screening tests. The first one being a colonoscopy. I think that's the most well-known screening test. A colonoscopy does require some preparation. To prepare for the test, you have to follow a special diet and follow a preparation plan that will clear out your colon and rectum so that the doctor can see the inside of your lower digestive tract clearly. During this test, your colon rectal surgeon will examine your colon using a long, thin, flexible tube with a camera and a light at the end of it. And if polyps are found during this test, they're removed at the same time. And once a colorectal polyp is completely removed, it rarely comes back. However, at least 30% of patients will develop new polyps after removal. And for this reason, your physician will advise follow-up testing to look for any new polyps, and that's usually done within 3 to 5 years of that initial polyp removal. And then down here after colonoscopy, we have some at-home options, at-home colon cancer screening tests. On this side here, we have a fecal immunochemical test, or a FIT. And this test is looking for microscopic blood in the stool, as well as a biomarker that can indicate that precancerous cells may be present. And the idea behind this type of test that's looking for blood in the stool is that the blood vessels in larger colorectal polyps or cancers are often very fragile and easily damaged by the passage of stool. And so these damaged vessels, they can bleed into the colon or rectum. And although it's such a small amount of blood, we can't see it with the naked eye. These tests can actually detect it. And so these tests, they're done in the privacy of your own home. You don't have to do any drug or dietary restrictions before the test. You just go to the bathroom, complete the test, and mail it in. And on the left, you may have seen a lot of commercials for this. That is Cologuard. It's a stool DNA test. So it's looking at the stool like that fecal test, but there's also a DNA test component to it. And Cologuard, or these stool DNA tests, are looking for certain abnormal sections of the DNA from cancer or from polyp cells, and also it's looking for that hidden blood, that microscopic blood. In colorectal cancer or colorectal polyps, the cells often have DNA mutations, and cells with these mutations often are found in the stool, and that's where these tests are then able to find them. And these tests, the stool DNA test or Cologuard, should be done every 3 years. So that FIT test, that fecal test on the with the blue bags on the right, that's done every year, and the Cologuard test would be done every 3 years. Also, in the privacy of your own home, you just mail it in. There are no drug or dietary restrictions with this test either. With all screening tests, false positives or false negatives can happen. And just be mindful that if a test is positive, if one of these at-home tests are positive, you'll have to then go for a diagnostic colonoscopy to see if there's any polyps present. So who should get screened? Well, everyone ages 45 to 75 should get screened for colorectal cancer. If you're at a high risk for colorectal cancer, you may need to get screened before age 45. And talk with your doctor if you're over the age of 75 about your colorectal cancer screening options. And the Cancer Services Program is a New York State Department of Health funded program that pays for colorectal cancer screenings, as well as breast cancer and cervical cancer screenings for individuals living in New York State who do not have health insurance and they meet certain eligibility guidelines. So if you need help paying for cancer screenings or diagnostic care, please give us a call at 585-224-3070 to help you out. And thank you so much for joining me, and I hope that this Got Health video helps you achieve better health and wellness this year.